It's called a magnetic resonance imaging, pretty amazing. They take the vertebrae like this and they cut it right in half, like that, and then they place it to the side like that. It's called the lateral view, right? It's a side view. So, this is the front of the body, this is the back, this is the sacrum, your tailbone, and this is what we call L5, 4, 3, 2, and 1 vertebrae. This is your shock absorbers or disc spaces in between like that. 5 lumbar vertebrae, and then you got 5 shock absorbers. The spinal cord is in the back like this, that's the dark area, and the white area is the spinal fluid, that's where the cord lives. Right? All right, so if you look at the most normal disc space, which would be the thickest of all disc spaces, and compare them to the rest. All right, so there really isn't any normal disc space in the lumbar spine, but if we were to look at the thickest, it'd probably be this guy right here. Yeah. And this isn't completely normal because if that's a quarter inch in the front, it ought to be a quarter inch in the back. So you can see the slight compression right in the back, probably like this. But if this is a margin of being what is normal, you can see the slight little bit of difference like this. Look at this up here, like that, right? But if you look at this, same thing here, you can see the difference, like this, and then it's squeezing right here. This is what we call a degenerative joint disease, where the disc starts to shrink like this. So the mechanics is when that does that, there's a little hole where the nerve comes out of the spine and does that. It decreases in circumference. We call it stenosis. Stenosis or stenotic means closed. What's it closing in on? It's closing in on your nerve roots, right?
Yeah.
Right? This is L4, 5, and S1. These are where the bulges are. That's degenerative joint disease. Now, the other thing that you have is what we call bulging disc. See that bump right there?
Mm-hmm.
That's one of the biggest bumps I've seen. This is a 5 millimeter bulge, right? I'm going to tell you what that does here in just a minute. So the bulge here, the bulge here. So you got a 2 millimeter here, a 3 here, and a 5 here, right? All right. So what happens regarding that is when it basically just crowds the area where the nerve comes out of the spine. All right. So here's the bulge. There it is right there. You got 3 of them. So what it does, it just pushes up there on that nerve root. So you have what's called a double crush syndrome. The double crush syndrome means that you got pinching of the nerve coming from the bulge, and then from the decrease in the joint space like that. If you cut that guy off right here, all the way up like this, and you just have the degenerative joint disease, you got nerve compression. Conversely, if this is open, nice, all the way through, but have the bulge, you got nerve compression. The unfortunate theme for you is you got what's called the double crush, which means that the symptoms are coming from pressure in 2 different places, right? The decrease in the joint space, which is degenerative joint disease, and the bulging disc, which is basically a leak. Remember, 70% of the disc is water. And the middle portion is basically 70% water, 30% gel. So that gelatinous and the water comes out, produces a bulge, and the bulge puts right on that nerve. Right? Okay. Now, once you look at the color, see the difference between the color like this? See that white like that?
Yeah.
White's water. White is good. See the black like this?
Yeah.
That's desiccation, means the disc is dying, right?
Yeah.
Means it's losing or it's lost the water content. We want more white than we do black, right? Now, fortunately for you, it's pretty much white all the way through here. The worst distance you have right here that's giving a lot of the problems is the S1 nerve root like that, right? L5, sorry, L4, 5, and S1. This is where the problem is like that, all right? All right. So, the answer to the first question basically is yes, we call this a progressive degenerative joint disease of your spine. Now, progressive just means everything we just talked about here is going to get worse. Now, the second question, equally important, and that is there currently a medical condition you have right now that will stop you, preclude you from being treated safely here? Fortunately for you, not now. But if you weigh any one of the 3 things we just talked about, taking the disc space first, what do you think is going to happen to the disc space? Does it get smaller or bigger?
Smaller.
It gets smaller, like that. When this gets smaller, what happens to the circumference of the hole? Does it get very bigger or smaller? That's right. Circumference of the hole gets smaller, compressions on the nerve. Now, the leak, what happens to the bulge? Does the bulge get bigger or smaller?
It gets bigger.
Absolutely, it gets bigger because it's just a fluctuation of fluid back and forth. This is what we treat on a daily basis. 90% of the time, the patient gets better. Listen, this is not rocket science. If you take the pressure off the nerve roots, symptoms disappear. That's essentially how it works. All right? Okay, any questions on that? How we doing?